Hello, Jim and Janice Halsey here to answer this question. Won't Medicare pay for my long-term care expenses? No, Medicare will not pay for your LTC costs. It was introduced in 1965 and was designed for people 65 or older to get them better. Medicare was never designed to pay for long-term care. In other words, if you will be living in a nursing home or if you will need around-the-clock care at home, Medicare doesn't pay for these services. Medicare is for acute, short-term medical care and rehabilitative care only, and even that for only a limited period of time. It was not intended to cover chronic illnesses such as Parkinson's, Alzheimer's, or strokes. At best, Medicare and a good Medicare supplement will pay for a maximum of 100 days of inpatient rehabilitative care in a nursing home or a rehab center. It's very rare that a patient gets covered for nearly that long because they must be in what's called improving condition according to Medicare standards, or they just get discharged.
My dad was paralyzed by a massive stroke and received Medicare benefits for a few of the 100 days. For that very reason, when he stopped improving at rehab, he was sent to a veterans center where he spent the last 9 years of his life in a wheelchair. Most people don't realize that Medicare only picks up the full tab for a maximum of 20 days. After that, it covers 80% of the cost up to the 100-day limit. Hopefully, you have a good Medicare supplement to cover the remaining 20% balance. There's a great deal of confusion regarding Medicare and Medicaid. The names are quite similar, but that's where the similarity stops. We've already established that Medicare is not intended for long-term care.
Medicaid, on the other hand, is the safety net under all of us to pay for long-term care if we're impoverished. It's intended to be the payer of last resort for frail, elderly persons with health problems requiring long-term care services. It does so with significant restrictions, though. It covers the cost of care in a Medicaid bed, in a Medicaid licensed facility, in a shared room, and there's often a waiting list. You must spend down certain of your assets before being able to use this program. Qualifying to use Medicaid to pay for long-term care while protecting as many of your assets as possible can be a very complicated process. We can provide you with access to an excellent elder law attorney who can walk you through this journey.